The Appalachians. Appalachia is a region full of natural resources, timber, coal, and the rugged mountainous and natural beauty. Appalachia covers parts of 13 states: Georgia, Alabama, Mississippi, Virginia, West Virginia, North Carolina, South Carolina, Kentucky, Tennessee, Ohio, Maryland, New York, and Pennsylvania. Communication. English is the main language spoken by the Appalachians. Some groups of Appalachians speak Elizabethan English, which affects vocabulary and pronunciation. They do not trust outsiders and often do not share their thoughts and feelings very easily. They typically are quite private people and are sensitive to talking about personal issues. Traditionally, Appalachian families are patriarchal. The men work to support the family financially, and the women take care of the house and raise the children. Older matriarchs are held in high esteem as the healthcare providers, taking care of the sick and ailing. Children are expected to attend elementary school, but continuing education is not a main concern because teens are expected to help supplement the family income. Family is very important in the Appalachian culture, and nuclear families are often very large, and extended families live very close by. The Appalachian community is predominantly white, with some mixture of Cherokee and other Native American background. A very small number of blacks, about 3.2% of the black population, refer to themselves as Appalachian. It is hard to differentiate Appalachians from other white cultures due to very few physical differences. There are certain health conditions commonly found in this culture. The majority of the Appalachians' fair skin puts them at higher risk for burns and skin cancers. The living conditions commonly found in this culture and the occupations that are hard on the body also put these people at higher risk for conditions such as black lung, brown lung, emphysema, and tuberculosis. The people also have a greater risk for heart disease and diabetes when compared to the national average. Smoking and drinking are very widespread, and these behaviors are even commonly found among the teenagers in Appalachia. Food means more than nutrition to the Appalachians. Food is a sign of wealth. One should eat a lot of food and drink a lot of fluids if he or she wants to be strong. Having bodily strength is considered being healthy. The foods that are eaten are often breaded or fried with lard or animal fat. Meats are often preserved with salt, contributing to a high sodium intake. Babies are fed grease, sugar, and coffee from 1 month of age to promote a hardiness. Hypertension and deficiencies in vitamin A and iron and calcium are prevalent. Children and adolescents in particular often replace meals with unhealthy alternatives like candy and soda. Lack of education, grocery stores, and funds to contribute to these lack of funds contribute to these nutritional deficits. The original settlers of the Appalachian region were predominantly Protestant and Episcopalian. Creating central organized churches proved difficult, leading to the individuals creating their own. Today, the main religions are Baptist, Methodist, Presbyterian, Holinist, Pentecostal, and Episcopalian, with a few Roman Catholic and Jehovah's Witnesses as well. There are many divisions among these faiths that allow for personal beliefs that are quite diverse. The best way to describe Appalachian religion is by calling them sects. Generally, most churches have important central beliefs that tie them all together, such as fundamentalism and the strict use of the King James Bible. It is believed that one lives well in this life, being kind and doing good, God will reward them in heaven. Prayer is key in the lifestyle of most Appalachians. These people consider themselves to be religious, whether or not they regularly attend church. In regards to health, Appalachians believe that whatever happens to a person is God's will. Therefore, one may not seek help until their health is in dire trouble. The healthcare provider that is competent and respectful of this culture's beliefs and spiritual practices will be more respected and potentially listened to by these patients, and their advice will be taken more seriously. There are many beliefs and traditions surrounding pregnancy, birth, and death in Appalachia. When a woman gives birth, many members of the family come to assist with day-to-day household activities and care of the children. Several beliefs surround pregnancy that affect the mother's diet and activities. It is believed that stillbirth can be caused by taking a picture. It is thought that if a mother gives into food cravings, the baby will have a birthmark shaped like the food, and that birthmarks can also be caused by strawberries and citrus fruits. It is believed that if the mother reaches above her head, the umbilical cord will strangle the baby. There are many more teenage pregnancies in this culture compared to non-Appalachians. Contraception and sexual activity are generally very sensitive topics, especially for the younger population. Death is an important event to the Appalachians. Even outside employers recognize this, and those that work in factories are often given 3 days off for funerals. The bodies of the deceased are displayed for hours so that all who knew the person can view the body. Funeral services can be hours long, with the service being longer the older the person was. Many people have their funeral services already planned out prior to death. They are often buried with some of their favorite possessions. After the service, there is a large meal. The cemeteries are well taken care of and often have flowers adorning the graves. Appalachian healthcare is driven by beliefs such as family, traditionalism, self-reliance, and individualism. The belief that health is God's will and the attempt at self-reliance and following tradition will usually lead many to exhaust all other forms of healing before seeking help from a formal healthcare provider. These other forms of healthcare include self-medication, herbal and traditional folk remedies that oftentimes have little to no effect on the illness. When they finally arrive at a clinic, their condition is much worse and they require more resources for treatment and have less favorable outcomes. Individuals will generally accept these outcomes as God's will. Typically, Appalachians will go through several steps during the health-seeking process. They will try to self-treat the symptom, then would seek their mother or an older woman's advice. Over-the-counter medicine will be sought after and attempted next. They then will often ask friends if they've had similar symptoms and attempt what treatment is suggested by them. Often, the first healthcare professional they reach out to is the closest pharmacist. This pharmacist will suggest that they visit a clinic or some urgent care, but the individual often persists that the pharmacist give them recommendations for more over-the-counter options. Eventually, when the symptoms persist or worsen, an actual healthcare provider is sought after. These steps often take place over several years. The individual is often in such bad condition that he or she ends up in the hospital with a poor prognosis and may discharge with lasting effects or may even die while inpatient. This creates a sense of distrust toward hospitals and professional health care in general amongst the Appalachian population. Healthcare personnel intending to provide for the Appalachian community need to become acquainted with many concepts that drive the beliefs of those seeking care. Some special things to consider would be that trust needs to be built between the client and provider. The provider needs to watch out for the use of Appalachian dialect to ensure that he or she fully understands the patient's needs. Special consideration needs to be taken when collecting history from the patient because they often have tried many other remedies for a problem before reaching out to a professional healthcare provider. The healthcare provider needs to keep in mind the living conditions and work environment of the client, which may affect diagnosis and treatments. Several educational points can be made to the typical Appalachian. Diet and nutrition education is one of the primary needs in this population. Using the concept of self-reliance as the result of following the suggested lifestyle changes will be a more successful approach due to the desire to take care of one's self.